Hello, I'm Dr. Andy Loetscher. I'm an oral maxillofacial surgeon, and I want to discuss with you the benefits of choosing us to have your wisdom teeth taken out. Whom you go to is a really big decision because having your wisdom teeth out is a surgical procedure. It involves surgery, it involves anesthesia, and a definite recovery period. There's also a cost involved, and you want to have reasonable fees, which we have. Our practice has a stellar reputation for providing good quality of care. We have a group of assistants that are well trained. They're surgical assistants, surgical technicians, and we actually have 4 registered nurses working with us full time. So there's several things we do that many practices don't. Number one, believe it or not, we place sutures. It seems intuitive that you would have your incisions sewn up with sutures, but probably the majority of oral surgeons don't because they add 30% of the time to the procedure. We place sutures, we go at a slower pace. Sutures, I feel, are critical because it closes up your wound. You're going to bleed less, you're going to heal better, less infection rate, and it makes your overall recovery much nicer. I think that's a big deal. Another thing that we do differently, which I think is very important and probably one of the bigger benefits people coming here they don't know about, is I'm actually not only board certified in oral surgery, I'm board certified in anesthesia. That's a big deal because we can put you all the way to sleep, just the same way it's done in a hospital. We have identical setups as a hospital would in our surgical suite. You're monitored just like you would there, and you're also all the way to sleep. So our patients don't wake up partway during the procedure. Also, we treat a lot of children and special needs patients, and our nurses are very adept at taking care of those patients. The big deal is actually a lot of kids come in with a needle phobia, and so we have a nice protocol down where patients come in if they have that concern. We put a little mask over the nose. After about a minute or so, they're breathing a little bit of an inhalation gas. We tell them it smells like grandma's perfume, and they fall asleep, and they wake up. The procedure is done, and they will never see a needle. Once they're asleep, we start their IV and so forth. It's actually a really big deal for a lot of children and people with needle phobias and a few adults. One thing I wanted to mention, we have a concierge service, which is basically when you come in for your surgery, we provide you with a card for a concierge, and it's got a number on it that our nurses carry, a phone that you can text her with questions after hours or weekends, and she can call you back. So that's a nice service. Plus, we, the doctors, are available after hours as well if you need to get in touch with us. If you are thinking of getting your wisdom teeth out, you can give us a call and we will, I'm sure, take good care of you.